The Nigerian Center for Disease Control and Prevention has issued an alert following the outbreak of cholera in more than 25 states around the country. Good evening, welcome to Sound Health on Lagos Television. I am Olasumbo Modupe. This is our focus today on the program. Stay tuned, the conversation begins after this break.
What if we could design an economy that would prioritize the health of all people and the planet we live on? Where a successful economy is measured based on every person's contributions to society, and health is seen not as an additional cost or potential budget cut, but as a necessary investment for our future. A world in which health innovations are shared for the common good so that everyone can access the healthcare they need wherever they live in the world. And where governments have the capacity and resources to drive these changes. This is the vision of the WHO Council on the Economics of Health for All. The Council makes 13 bold recommendations informed by evidence and case studies from around the world. These recommendations should serve as a compass to guide us all towards a world in which people, planet, and the economy are aligned. Because the question is not why should we, but what's holding us back.
It is still Sound Health on Lagos Television. Joining us this evening is Dr. Olusegun Badejo, State Health Educator, Lagos State Ministry of Health, and he is going to give us updates about the cholera outbreak in Lagos and Nigeria, as well as precautionary measures. Good evening, Dr. Olusegun Badejo, and thanks for joining us.
Thank you very much, presenter. I'm glad to be here. And good evening, Lagosians.
All right, Dr. Badejo, over 60 admission cases, more than 5 deaths, as well as more than 1,141 suspected cases in over 25 states in Nigeria. Tell us, is there more that we need to know about this recent outbreak?
First and foremost, I need to correct this, that the figure you gave is from Lagos State. So we have an outbreak of outbreak of cholera in the state. There is no doubt about that. We also have 60 admissions and 5 deaths across the following local governments. We have Koshofe, we have Mushin, we have Lagos Island, we have Lagos Mainland, so we have Ikurudu, etc. So these are where the public health facilities there are where we have gotten this. Our surveillance system actually revealed this. So based on this, cholera generally is a waterborne disease that affects both men, women, and the children. So in Nigeria, we, like the presenter earlier on said, we have over 1,000 cases, and of course we have close to 30 deaths across the nation in 25 states of the Federation. So it is a public health emergency that actually need to raise concern. So the Lagos State has made a press release that we have cholera outbreak in the state, and of course all hands must be on there to ensure that we contain it. So cholera is caused by a bacteria which is called Vibrio cholerae, and of course within 2 weeks of it get access through injection into the system, it establishes itself if the body system is immunity system is very, very low. So this is very, very key, and the outbreak is still ongoing, and that is why it's ensured that we ensure that we contain this scourge. And when you have a cholera of this scourge, there are certain things we actually need to look at. Actually need to look at the risk factors. What are the things? What are the reasons for this? this is caused by contaminated food. When the foods are contaminated and they are consumed, and water contamination and we are consumed, when we have a poor personal hygiene, poor environmental sanitations, all these things count, and of course they are responsible. When food are not properly handled at three sources: one, at the level of production, at the level of storage, and at the level of preparation and processing. So if we don't ensure that this food are safe at this source, then we could have a lot of problems on ground as regard cholera in the state.
What are the symptoms? Is cholera the same as PAL? Is the presentation the same as PAL?
Yes, I need to let us know this, that when it comes to gastrointestinal infections, there are symptoms that are similar from one infection to the other. Like we have the diarrhea, and we have a gastroenteritis, where we also have cholera. But as in case of cholera, two things are very, very significant. There are one, there is passage watery stool, which may not be controlled. Then number two is that we have vomiting at the same time. So that's exactly the distinguishing characteristics that make it different from other gastrointestinal infection. The person is losing fluid through the feces and at the same time is vomiting. So other symptoms like body cramps are there. We have fever. We also have weakness. The person is tired. We have constant vomiting, like I have said initially, and above all, dehydration, because the client or the patient is losing fluid constantly through vomiting and through passage of watery stool. So these are sign and symptoms. Anytime you see this, you see somebody vomiting at the same time stooling, that person has cholera disease.
Earlier you mentioned cholera is caused by contaminated food and water. Equally, the World Health Organization reported recently that millions are at risk from cholera due to lack of clean water, soap, toilets, and shortage of cholera vaccines.
Well, the current situation as regards that is that, yes, like I mentioned, the source of water that we consume, where do we get the water? So there are various sources. There are those that have boreholes. There are people that fetch water from whereby streams. And of course, I want to say this, and that's why we have always been saying that our proper way of disposal of refuse and of course feces are very, very key, because you see cases where people that live around the slums, we have a lot of people who don't have toilet system in their homes, and of course what they do is that they defecate everywhere, and this litters the water and contaminate water. So anybody that picks it will have issue. And don't forget that the host of this Vibrio cholerae is the housefly that goes about, and wherever he sees the feces, it jumps onto it, and of course living there, he come and meet us at home. Don't forget that when we also fetch this water, we go and drink it. So that's an issue. And when our food are contaminated too, is also is an issue. We need to know, where are we getting our food? Where are we getting our food? If you go to an environment, a bukateria, or you go to a restaurant, or you go to any shops where, or to the vendor who is selling food, you need to look at the around, the environment where the food is prepared. So if we have unhygienic environments or situation, we could have some people that while they were preparing the food, you see a lot of flies around and they are not being controlled. So definitely there is no way that the food will not be contaminated, and of course people would definitely take it and come down with cholera. And again, the vaccination that are available, if they are not given to the people, or people do not access or have it, then we could have an issue, because the vaccination is supposed to increase body defense system increase body immunity, so that anytime that bacteria comes in contact in our body or gets into our body, then it will be overwhelmed, it will be controlled, and will not be allowed to establish itself before it progresses to signs and symptoms.
Is the current cholera outbreak synonymous with the raining season? Because most areas you mentioned are also experiencing flooding.
Yes. Yeah, usually we can have a cholera outbreak anytime, any period. But it's more during the rainy season. Reason is that when you have flooding, that's why I mentioned the people that are living around the slopes. So especially we have a lot of water there, and which attracts a lot of pests, which attract a lot of flies. And don't forget that when people now contaminate by defecating all around, then we could have an infection outbreak surrounding that. Because don't forget that those flies that are touching those feces are coming to visit us at home because they want to pick food. So for food that are not covered and or leftover food that are not covered or not well cooked, then we could have an issue, because once you take it and you take the bacteria, then we have a lot of inflammatory response that comes down with it, and a lot of damages that comes to body system, and before you know, then you have the infection. So if we don't contain it through ensuring the precautionary measures, they will see that we may not be able to control it. But as state government, we are doing all our best to ensure that this scourge is what is contained, and we don't allow it to spread and bring it to a BRS minimum in Lagos State.
Tell us, Dr. Badejo, what is the protocol for the cholera outbreak? What steps should be taken?
There are protocols in managing an outbreak like cholera or other public health emergencies in the state. Number one, that is what we call disease notification system. Don't forget that we have state disease surveillance and notification officers, and this is replicated in the 20 LGAs and the 50s and the 37 LCDAs in the state. So we have disease notification officer in each local government. So what they do is that they carry out surveillance from everywhere. They get their notification, they get they make a lot of, they get information from the health informant around that particular local government or community. So they now upload whatever they get to the state, and from the state to the Directorate of Epidemiology, Biosecurity and Safety, so which is responsible for curtailing this system. So once this is done, it's a protocol. So once this is done, then an emergency operations center, public health emergency operations center, which is situated at Yaba General Hospital, which is an infectious disease hospital. So at that particular, all of us are going to meet. We have the surveillance system will be there. We have the risk communication and social mobilization. The ambulance, the evacuation, they are there. So we have the security, all of them are there. The IPC, everybody is there. And what are we doing? We're sitting together to actually develop a response plan that will enable us to contain this. So that control from that level, then the surveillance system, the laboratory system will take samples, and they will take it to the laboratory and do analysis and find out, is it truly the Vibrio cholerae that is causing this problem, or there are other viruses or bacteria that are responsible. So through that, they are able to detect it. So the detecting it, then we now take steps to contain it, and also affect the risk communication. We will go out, we talk to people, we let them know, we create awareness. How do we create the awareness? That's exactly the same thing what I'm doing here now, to allow the public to know that we have public health emergency in the state, an outbreak of cholera. So it doesn't end there. We also go to our LGE through our collaboration, the health promotion unit of the State Ministry of Health, in collaboration with the Directorate of Health Promotion and Health Education of the Primary Health Care Board, and of course through the Office of the Director, Health Education in 6 health care in the 6th district in the state. So we work together. So we carry out what we call house-to-house sensitization. We do a motorized rally. We carry out motor park storm. We carry out market storm. We carry out a mass city campaign. So all these things are what we do. So, and while we are doing that, we have our social and behavioral change communication materials, which we have in form of flyers. So we spread it that contains information. So in our community engagement, we do a lot of advocacies to the gatekeepers. And the gatekeepers are the traditional rulers. We have the youth leaders, the market leader, men and women. We have the TBAs. We have the religious leader. So we let them, we sensitize them. So what they will do now is they will now also cascade this information and the knowledge we have given to them to their members, so that the information continue to progress and spread across the state. So everybody is aware and everybody is able to take precautionary measure to ensure that we all contain or reduce the scourge of this in the state. So all this community engagement and all these responses are very, very key. Don't also forget that we also have a reporting system. Like if there is any community, we have an outbreak, we also ask them they need to notify their health department of the local government, or they come to the Ministry of Health, or they make a call through our regular toll line, free line, which is 767 and 112.
When do you tag an incident, an outbreak? Must you record over 5 deaths before you tag an incident, an outbreak?
No, it's not a medical terminology. Like, for example, when you are getting cases like 5, more than 5, reporting at a health facility, whether at the primary, whether at the general, which is secondary care level, or at the tertiary care level, all you needed to do is that you must report to the State Ministry of Health.
I know we have an incident commander in Lagos State, and I'm sure there are precautionary measures put in place. Let us know about the measures in place at the state level, at the federal, as well as community.
For precautionary measure, something that is sacrosanct first is that we must ensure that the food we eat are not contaminated. We must ensure that our food at these sources, from the production, from the storage, from the process and preparation, they must be free of contamination. That is very, very key. Then we must also ensure that wherever we are getting our food, the environment must be very, very clean, must be very, very hygienic, not in a housefly infested environment, because the housefly is actually the host of this bacteria that can be deposited on food, and of course man can also pick it. So that's very, very key. Then number 2 is that the water that we are taking, we must ensure that the water are coming from a safe point. So we are not just drinking any water. Even at this particular point that we are suspecting and we are seeing cases, we advise that if you want to take water, boil the water, process it, so that if there are any bacteria or viruses there, or fungal or whatever, it will have been destroyed before we actually consume it. So that is very key. Then all bottled water that are not properly covered, or the source are not, we are not sure, we should not drink it at this particular point in time. Then we must ensure that we have adequate personal hygiene. We must wash our hands regularly with soap and water from time to time. Anytime that we visit toilet, we must ensure that we clean our hands, and of course with soap and water. So all these things, then our environment must be very clean. So good sanitation is very, very key now in this time that we have an outbreak. Good sanitation is very key. So through the good sanitation, we'll be able to contain a lot of infection that could arise, and of course affect man. So all these things are very, very key. Then when we have an outbreak, we need to notify. So notification is very good to the Ministry of Health, to the Department of Health of that particular local government, so that we be able to contain it. So now everybody must take responsibility for whatever they eat, for whatever they drink, and the way they live their life. So this is so these are the precautionary measures that we'll be sending to people from time to time. Don't just eat anyhow. Don't just buy food anywhere. Just be sure that wherever you are buying food, your food are safe. So all these are very, very important, and we must continue. So our fruits, our vegetables must properly washed, must properly peel off before we consume them. So our food must be properly cooled. So meat properly fried before we actually start consuming them. So these are the things that we must do. So at the level of the Ministry of Health, our job is to create awareness, and that's exactly what we are doing. So at the level of Ministry of Health, we must ensure that any patient that suffers from cholera that is taken to the hospital have access to drugs. Then there are medical equipment, there are investigation equipment there. We have the medical experts, the doctors, the nurses, and the rest that are going to, the laboratory officers that are going to take care of the patient. So all these things, once they are there, immediately the patient actually get there, you have access, you are treated. A lot of people have been treated. Like I mentioned earlier on, 60 people have been admitted and 5 are dead. So others have been discharged, they are back home. So in the state, we should not be afraid or panic. Anytime we have such, then the patient is taken to the hospital promptly, then the patient is going to have access to medical care. Then at the level of the community, advocacies have been going on from time to time to all our gatekeepers so that they continue to spread the knowledge through the CDAs, through the CDC, through our social mobilizers and etc. So all this trend continues in the community. Then there are refuse dump site far from where we live and far from where the stream passes through or the river. So all these things are very key. And even at home, when you want to dispose it, there is a recommendation by the state government, Ministry of Health, that all you need to do is to get a black polythene bag, put it in a container and put a rope and tie it. People should not just defecate anywhere and anyhow.
All right, your call to action now vis-a-vis the global strategy for ending cholera outbreak, because we have less than 6 years to this roadmap.
When we have an outbreak, then the client must be taken to the hospital immediately. And of course, we must ensure that the incident command system of the state is followed strictly through appropriate protocols. So all these things are very key. So people must also take responsibility for their health from time to time. Must be careful of whatever we drink, whatever we eat, and ensure good personal hygiene, good environmental sanitation, and of course ensure that we stay healthy and we take balanced diet. Take balanced diet to provide immunity, especially in our diet must contain vitamins. We must eat the fruits in season. So all this one is going to boost our immunity, and we'll be able to fight against any invading bacteria or viruses or fungus or amoeba or protozoa or all these microorganisms that initiate diseases in our environment.
Thank you so much, Dr. Olusegun Badejo, State Health Educator, Lagos State Ministry of Health. Thank you so much for your time and expertise, as well as precautionary measures on how to prevent cholera outbreak in Nigeria as well as Lagos State.
You're welcome. Thank you very much.
Sound Health continues with trending health report from around the world. Please stay tuned. The program has been Sound Health on Lagos Television. Trust you have learnt one or two things about cholera and how to prevent further outbreak or spread. Cholera is preventable and treatable with the proper diet and right hygiene. Report cases early enough to the nearest health facility. For comments and inquiries, or you have topics you'd like us to treat, please send SMS to 00358 to 6603 or follow us on social media at Lagos Television #Sound Health. A sound health is a sound mind. Make healthy living your choice.